Time for us to visit with Dr. Laura Morris from MU Healthcare. She's been very kind to give us this time almost weekly. I think we've only missed 1 week over the last probably 4 or 5 Wednesday mornings, getting an update about vaccine distribution to the state and also especially to the county and the city, and then also how vaccinations are going. Dr. Morris, good morning. How are you?
Good morning. Thanks for having me.
Let's start with as far as anything that you can tell us in regard to schedule this week with the cold temperatures and the snow that we've had. I think there are some who are hearing state stories about vaccinations that have been put on hold because of the weather. How about here locally?
So here locally, our MU Healthcare vaccination clinic has been up and running. This weather is difficult and challenging, but our staff have been there, our vaccine doses have been there, and we have not closed that vaccination site. So if you have an appointment, expect to keep your appointment. And if you cannot, and then reach out and we will absolutely reschedule. We're aware we can't predict what Missouri will throw at us, but we absolutely have not closed our vaccination clinics.
And this is for first and second doses?
Yes. So if you have a second dose scheduled, that dose is accounted for. That dose is reserved for you. We will not give that dose away to someone else. The first and second doses are coming from different pots, so to speak, different batches. So no worries that if you cannot make your appointment, you need to let us know and we will help you reschedule, but your dose will not be given away.
So a couple of weeks ago, you had the first opportunity to do, and I think it was a Thursday, Saturday, about 4,000 doses. And so now I guess it's who's getting the second doses now? That would not be from that group, right? Because that's only 2 weeks ago.
Correct. That was our first time administering Moderna vaccine, and of course the timing for the first and second doses is slightly different. The interval for Pfizer doses is 3 weeks and the interval for Moderna doses is 4 weeks. So we are still receiving on schedule Pfizer doses for finishing up the second round for folks who got their first Pfizer dose with us about 3 weeks ago.
And then there's going to be another round of the Moderna doses on Friday and Sunday this week, and that should be a total of, 4,000 on those 2 days?
Exactly. That's kind of our expectation with being that high-throughput vaccination center from the state. We were going to receive those Moderna shipments on a regular basis, and then we will, of course, receive the second doses, and we have those folks accounted for and scheduled. So when you receive your first shot, you need to make sure you have your second shot scheduled.
So the vaccine that you get and administer through the hospitals in this community and the health department, that comes from the state. The pharmacies that are having some vaccine to do through vaccinations, that would be what, federal program?
So actually the state has decided that they're going to divide up the allotment of vaccines that they're getting from the federal government into a few different areas. And so one of those is sending vaccine to those high-throughput health centers, such as the University of Missouri, where we're doing those thousands of doses at a time. And then there's the portion that's going to pharmacies, and some of those doses are going directly to small chain pharmacies, here locally. Folks like C&H and Flo's Pharmacy have received a few hundred doses at a time. And then the rest of that pot gets divided up among health centers that are not part of the high-throughput health clinics. So, for instance, Boone Hospital and other local and regional hospitals might receive some doses, typically not quite the same numbers like the 4,000 that university is getting.
MU Healthcare, Boone Hospital, and the City County Health Department, I think they did something really good, and that is at the end of last week, I think the release came out saying that if you sign up for one, and they're calling it the survey, I call it the sign up, or otherwise basically you're registering saying you would like to get a vaccination when it becomes available. It's one stop or one spot now, and you cover all three. Is that right?
Absolutely, and we've been collaborating with those partners behind the scenes, and now it's kind of upfront and obvious. So there is one link, one survey, one sign up, and that is the muhealth.org survey we've been talking about on your show, and that is going to put everyone in the same pool. So we've already combined our responses from folks who have signed up locally through the health department, and we've removed the duplicates. what we would ask is your listeners, if they've already received a vaccine somewhere else, but they've put their name in our pool, please let us know so they can go back to that same survey site and they can opt out and tell us that they got their first dose somewhere else. So that way we make sure we're as efficient as possible when we're inviting folks for vaccines.
I like that. So in other words, if you've already received one and it came from a source other than what we're just talking about, those that survey that's done at muhealth.org, then please let them know. That way somebody else will have an opportunity to get a shot. What are you learning as far as the vaccinations are concerned? Anything new in regard to, like I see some headlines that I even hesitate to bring up. They're talking about maybe a one-dose possibility, but I don't think we're at that stage yet. What are you hearing about the effectiveness of what people have been receiving?
So far, so good. Certainly following that 2-dose schedule is what we know provides the highest level of efficacy. And there was actually a study published this month that looked at kind of real-world experience so far with the Pfizer vaccine, for instance. And the numbers were over 90%, 94%, I think, very close to what they've reported in their research studies. So that's really reassuring. I think there are a lot of strategies that we don't know much about yet. We don't have the data to support whether we should change. We do know that 1 dose does provide some coverage, but we know it's not as good as getting 2. So I think that's a decision that will come down, more information from the CDC, and hopefully also more vaccines getting their emergency use authorization soon.
We heard today that there was the 74th death in Boone County because of COVID-19, and this one is catching our attention because the person who died was between the ages of 10 and 19. That's an attention getter, Doctor.
That is an attention getter, and I think that really goes to emphasize there's been always some knowledge that certainly COVID-19 is a more severe disease in older patients, and by far the majority of folks who have died from this disease have been older. But, just because that's the majority doesn't mean that that's the only. And I think we need to emphasize with our young people that this is still a disease that's potentially serious. And hopefully these deaths still stay rare in our area. It's very sad.
Yes, it is. On the same note, though, maybe a little bit brighter news, some of the numbers that we're seeing as far as overall hospitalizations in Boone County and the number of active cases, which posted yesterday afternoon, was 171. That number hasn't been that low since back in the summer. We need to remember that we hit this peak in the fall and in the first part of the winter that was just extremely high. And even though we can talk about lower numbers now, those numbers still were startling when you looked at them back in the summer. They seem pretty high in the summer. So a good trend right now. What would you say about what we're seeing in the numbers over the last week or so?
Absolutely. It's a matter of perspective, right? So you're absolutely right. These numbers are trending down, and we are optimistic. I think when I spoke with you last, I'm kind of guardedly optimistic, and now more of a sustained drop, so that can be something we can feel good about. But you're absolutely hit the nail on the head with the fact that those numbers were shocking and startling, last summer. And so we're still at a place where there's a lot of COVID in the community. So even more important to kind of hold strong with our protection measures, like keeping our distance, wearing masks, and even for those folks who are vaccinated, our goal is to get to a place we don't need that anymore, but we're not there yet. We need to get closer to achieving that herd immunity.
And those who receive the vaccinations, they've been instructed also, are they not on site as they get the vaccinations and after they leave to continue to wear masks and do social distancing and those kinds of preventive measures, even though they've gotten a vaccination?
Absolutely. And the reason is that even if you've gotten your vaccine, the majority of folks around you have not. And the vaccine is protective. It's excellent protection, but it's not 100% protection. And so if you're the only vaccinated person in a sea around you of unvaccinated folks and there's COVID bouncing around, well, about 1 out of 20 times people might become infected. They probably won't be seriously ill. The vaccine's going to do its job there, but it may be possible to continue to spread the virus. And so it's still important until we achieve that herd immunity that we still follow those measures and wear masks.
I'll let you go. Any final word that you'd like to leave with us for today?
On this beautiful snowy morning, I just encourage everyone to stay hopeful, to remember that vaccination is our promise and our way out of this, and to get your name in that pool if it's not there yet. Even if you're not sure that you qualify for this tier of vaccination, we anticipate that we will be moving forward and expanding who's eligible sometime soon this spring. So it's important to make sure you get your name on our list.
And that is at muhealth.org, correct?
Absolutely. And that list, remember, will get you everything in Boone County and our surrounding area.
Yeah, that is the one spot to register now, and you can feel comfortable that you're on all the big list. Dr. Laura Morris, thank you. Look forward to our next visit.
Thank you so much. Have a great day.
You too. This is KFRU.